we do the quality of life scale, and they talk about mobilities and what they love to do and what they don't. But you've got to put it in context, because my dog, who loved to run around at 2 years old, he's not running around like he did when he was 2. Now he's slowing down. And yes, I know he's getting his pain meds and he's getting herbal treatments and other things because I'm integrative, but I do use pain meds. I use everything that we have, and that's what integrative medicine is, the ability to use whatever we have, this multimodal management of things.
Hi guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode. Okay, everyone, I'm really excited to introduce our guest for today. We have Dr. Kris August, who graduated from Colorado State University in 1991 and has had an integrative house call practice in Ames, Iowa for over 17 years, focusing on geriatrics, palliative and end-of-life care, and Western herbal medicine. She writes, lectures, and teaches courses on topics of Western herbal and integrative medicine, hospice and palliative medicine, and self-care. Dr. August was co-author of the original 2013 IAAHPC guidelines and has 2 chapters in the updated textbook for the IAAHPC certification course, Hospice and Palliative Care for Companion Animals, Principles and Practice, due out spring 2023. Very exciting. Kris is a veterinarian, herbalist, educator, mom, scientist, and nature nerd who values self-care and slow time for all. Welcome, Dr. Kris August. How are you?
Hi, Eve. It's great to be here.
Yeah, you've done so much amazing stuff, and you're kind of one of the pioneers of what so many of us are doing today. So I'm really honored to have you here with us.
It's weird when I start putting it down on paper. Wow, I've done a lot.
Yeah, a lot can happen in 17 years.
Yeah,
or
it feels
more.
good. Yeah,
It's
30 as a vet, over 30. I can't believe it. I don't feel that old.
I was just reading a magazine article. My parents sent it to me. My parents are in their mid-70s, and they were like, we don't feel 70. We feel like we're like 30. And this article was like, there's a point for everyone that your biological age like seems to like split from internally what you think your age is. It's very interesting.
Yeah. Yeah. I'm still a 10-year-old kid running around in the desert in my head.
Yeah. I feel like I'm 16. I'm always 16. That's my age. I don't know why.
Oh.
But I hit my stride at the age of 16 for some reason. Yes. So first of all, I wanted to back up before we get into some of the good stuff, which is your whole story. But I first wanted to start out the episode by asking you what I always ask everyone. What is your favorite snack to eat on the road?
It's usually pretty boring. It's some healthy snack. It's like nuts, walnuts, or almonds. If I really need that sugar rush, it's dark chocolate. So definitely
Nice.
a chocolate hound.
I think that's really solid, and I think I mean, you're a, holistic vet focusing on herbal, so of course you're eating nuts and berries, the things you probably
Right.
pour from God knows where,
Right.
right?
Yeah, definitely some of that.
Very nice, and I think dark chocolate is always a safe bet. I think all of us need a little bit of that in our lives.
Yeah, I need the boost every now and then, especially those afternoons.
Mhm.
Mhm.
Same, same. Yeah, I have a little stash of chocolate in my car as well, and nuts, so I'm right there with you.
Good job.
So, can you tell me a little bit about how you became a house call vet and what that journey was like?
Yeah, yeah, definitely. So I married a classmate. So my husband's also a veterinarian. And so we graduated and went to Tucson, which is my hometown, and worked emergency. We shared an emergency job when we started. And then I started doing relief and I was working nights and days and just that I couldn't do. And so we worked for 7 years at that. And somewhere along the way, he said, "No way, I'm not going to be a vet anymore. I don't want to be in practice." And he got a master's of public health during that time. And and I continued doing relief work and had, a few clinics that I was working with regularly, but it wasn't corporate, but vets, especially then, had no business knowledge whatsoever and no real practice management skills or team building skills. And so it was just a struggle and it was really busy all the time. And I didn't have the time to spend with the clients that I wanted to. So I was pretty burnt out by then.
Mhm.
And then he got a job in Iowa. And so we moved to so he works at the university, at the vet school teaching public health. And at that point we were just over 30 and thinking if we're going to have kids, we better do it. And so we did decide to have a baby, and it was kind of funny. Right before we left Tucson, we had sold our little house that we had in Tucson, and we were living with my parents, and I was pregnant, and he was finishing his master's of public health. My parents were retired, and I was the only one working. The pregnant woman was one going out working.
Just holding down the fort. Yeah.
So we moved to Iowa with a 4-month-old baby, and I was burnt out. I didn't know anybody, and I just kinda said, maybe I'll work Saturdays at some point," but that didn't happen. We had a second child, and I really that was like the healing time for me because I was able to just kinda step back, step away from it, become the hippie mom, and find my hippie crowd that where we could go foraging and learn about the herbs in the area, this whole new ecosystem. And, so that was kind of my healing time, and somewhere along the way, our old cats that went to vet school with us, they became the geriatrics, and all of a sudden I wasn't practicing, and I felt this, I really wanna be practicing again, and because I wanna be able to take care of these guys, and I did some writing, I did some other vet things,
Yeah.
but I wasn't in practice. So at some point I decided, yeah, actually I let my license expire
Really?
and I could keep it inactive, so all I had to do was take the CE, but I let it go. I was like, "I'm retired. I'm not a vet anymore. Whatever I'm doing, that's not it." And within a year, I had started house call practice. That's after letting it go. So I needed to let it go to
Mhm.
be able to come back and figure out how I was gonna do it. And so I had little kids, and I knew I had to set boundaries. I couldn't be everything to everyone. And so right away everything, I said, "I'm not doing surgery, I'm not anesthetizing anything in people's homes, I'm not doing the spay on the kitchen table." I have my limits, and so people had to have kind of that backup thing, and here we've got the vet school, and so we've got an emergency clinic, we've got backup, so making sure people had, understood what they were getting into to have me as their veterinarian, and then I just more and more got into the geriatrics and the old cats. I love old cats.
Yeah.
I would see cats that hadn't seen a veterinarian in 15 years, and that was okay. I was able to work with them with palliative medicine, that they might need and, give them an in-home euthanasia. And it worked out really well. It was, I was flexible with my kids and able to do a lot of other things, learn about the herbs more and get certified. And, I got the graduate diploma in veterinary Western herbal medicine through CIVT, the College of Integrative Veterinary Therapies. and realized what I really wanted was to be an integrative vet. I wanted to have those longer conversations and have more time with people and really get to know them.
Yeah.
So,
Yeah. Wow. I mean, that story is so powerful to me because it reminds me of my own story, but also a lot of the stories that are out there, each in our
mhm.
own, manifestation of it. But like I have a list of questions that I want to ask you, but this just brought more questions into my mind. And
Right.
it's so very, very interesting that you had to have a complete undoing, a complete leaving of the profession of finding yourself and, like you keep saying, this healing time to be the mother that you wanted to be, to get into the foraging and find the community that was right for you, and from there, then you could reconstruct yourself from, like, the true, real you that wasn't just, like, what had been forced on you by vet school, right? Like, your husband left the industry, you left the industry, and from that space, like, really getting back to yourself, this is such a common story. It's similar to me too, like, I didn't 100% leave, I was doing a little bit of relief work, but I went and I was like, "Oh, I'm gonna be a yoga teacher, screw all this," and I became a yoga
Great.
teacher, and I practiced as a yoga teacher for a while, and from there, I could create my own house call practice and be like, "Is it that I want? What is it?" Because we can't see that when we're so burnt out or we're so used to almost this, like, learned helplessness, like, "This is how you have to be a vet. You have to do this, you have to do that, you have to do that," and it's not often until we completely detach and undo all of it, like, let it all go, that we can then again find what it is we love in the medicine and what we're inherently good at. Like, that palliative medicine came from wanting to care for your family of animals, your own, right? So it's just a
Right.
beautiful
Yeah.
thing. It's just like what an organic way to rejoin the world of the veterinary people, you know?
Mhm. Yeah. To do it my way.
Mhm, mhm. I
Yeah.
love
Yeah.
that, I love that. And, I mean, it sounds from your history of, being involved in some of the very early education in palliative care as well, that you're truly one of the pioneers of this type of work and that it's come from the heart, like, really what it is that you wanted to provide for these animals. This is really cool.
Yeah. Yeah, yeah, there are people that were doing it 20 years, 10, 20 years before that, that they're the real pioneers, but it was really neat to be there in that groundbreaking time. I was at the 2nd annual IAAHPC meeting and many after,
Mhm.
but so it was really neat to be part of that guidelines committee, just really thinking through what do we wanna say, how do we wanna say it, and it's evolved over time, and there's the certification course now that I have a few lectures in, and it's been really wonderful to just be part of the figuring out of it
Mhm.
because that was an evolution in itself.
That's really special for sure. Yeah, so I'm really excited to interview you today also because I mean, not only do you have that sort of background in palliative education, but you're also a course creator of your own course and that's how we connected. I've taken your course and I got to know you. I'm actively in your training right now and really loving it and it's kind of a course focused on I'll let tell folks about it, but it's this sort of supporting of our colleagues doing work of a similar nature to what we're doing and sort of like finding this authentic collegial mutual support for our own self-care and just being there with each other for it. And it's not veterinary exactly, but it's for veterinary professionals who need it so badly. So can you tell us about your program a little bit?
Sure. Yeah, yeah, it started out for veterinarians. I taught with Dr. Lori Dolman with Purple Moon Herbs and Studies, and we had the herbal apprenticeship and retreat, which she's still running. And I just had to back off because it was just too much travel and too much time.
Yeah.
But I still, we're still best buddies, and it's still a really cool course. But I did kind of the self care part of that herbal course as we were putting it together, and it just kind of kept growing. And then the pandemic came, and I had been in the back of my head saying, "I wanna make this into a course. I wanna make this into a course." And then so that there was that opportunity to have the online course, and Lori doesn't really wanna do online because she wants to do in person and hands-on with the herbs, which is, totally what she needs to be doing.
Yeah.
And so she's sponsored me with it for the last couple of times, but I'm gonna be pledging out on my own this next year with the course. So I'm excited about that as well. For me, it's like a forest school for adults, you know? It's like the woodsy preschool that I took my kids to, only now it's something we can do for ourselves because I got so much healing doing that as a mom. And I ran the little play groups and I sang the songs and made the little crafts. And so some of the crafts are actually from kids' preschool.
And
Like,
why not? Why not? Our inner children need to be nourished as well, right?
yeah. I mean, I think part of it was coming out of my science brain from vet school and work and moving into my creative brain and being able to kind of open that up more and explore music and art and everything else.
I relate to that so much. I've found that my career as a veterinarian has really had a way of almost sort of squashing the parts of me that are, I guess the manifestation of my inner child, speaking of inner children, which are music
All right.
and art and creating and, finding joy through those media. And so, I really resonated with your course. I'm still part of the way through it. I haven't completed it. But I mean, there was one moment where you were teaching us how to make a candle out of beeswax and you sent these like beautiful little like kits to people for every month. It was like, oh my God, what a special, you feel so cared for. And there was one month that you have to make this candle out of beeswax strip and like a little wick that you sent people. And I had previously really underestimated the therapeutic value of something so simple and so sweet, just simple, really simple. I made
Yeah.
this candle. I made a candle.
Right.
No, just
Uh-huh.
something really special. And I lit the candle and I was like, huh. The simple
Yes.
beauty of some simple self-care. And sometimes that's creating something simple. It doesn't have to be this like work of art. It can be a candle. Like we've been making candles for, so many generations of humanity. Why not me too? Why not,
Right, right.
special thing.
Yeah.
Mhm.
Well, I'm glad you enjoyed it. That's the whole point. It's really a simple course. It's not rocket science, and that's the point. It's to slow us down and get back to that kind of slow time. I loved in the conference, you had the speaker on slow medicine. Like, yeah, because
Yeah.
early on in my evolution, I found a book called Slow Time, and it
Mm.
was, there was the slow food movement,
Mhm.
making, growing your own food and making your own yogurt and all that stuff that
Yeah,
that I do.
that's
And
wonderful.
so that whole idea of slow time, slow medicine, and, coming back into the house calls was for me a way to do it more slowly.
Mhm.
And my other dark secret is that I homeschooled my kids.
Your
And it was
shameful
to
dark
give
secret.
them, it is, it's like,
Yeah.
I never really said that. I'm just starting to say it out loud now that they're in college and they made it.
Yeah, there's a lot of shame for not going the mainstream path and, like, not just in veterinary.
Yeah.
Yeah.
But I mean, that teaching my kids and going through that whole process also, it's in this course too. When we studied the weather patterns and then made nature journals, we're gonna make nature journals soon here in the course because now that spring's coming and we're opening up again. So
Mhm.
it's this whole exploration of things as we go through the season. So it starts in September and rolls around through May. And I wanted to start it in it's kind of it hits the school year, but also at the same time, a lot of people are busy during the summer. In the sort of theory of it, the summer is the south. It's got the cardinal directions. The sunrise is in the east, and that's spring and morning, and it's this feeling of inspiration. And then we get motivated and work around our way to the south, where and south is a place of hard work. And that, I think in our modern society, we spend way too much time in the south.
We
We're just
sure do.
overworked.
We sure do.
And so we jump on the wheel at siesta time. So the class starts at the point where it's time to take a rest. It's time to take a break. And then we move into celebration and kind of remembrance as we move into winter. And that spark of light in the middle of winter is what that candle symbolizes.
Mhm, mhm.
We look back around into spring again. So it's just how does each place on the wheel, how in each season feel and what does it do for you and how can we live a little bit more into that rather than, always being in the South, always working and, how do we take a break and recharge and get remotivated and find our creativity and all
Mhm.
those things that make life more whole.
Yeah, I love that. That sense of finding wholeness, and it doesn't have to be ego driven. It doesn't have to be creating something really off the wall, just like connecting with the earth as it is and letting our humanity
kind of seep back into the entire framework that we have evolved in, right? And I there's also a resonance between that sort of wanting to return to the seasons and to nature and house call practice. And one of the things that when I went to house call practice that I started realizing was like, oh my God, I can see the seasons again. I'm out there and like as I'm
Right.
cruising around, I'm getting rained on. I'm getting sunned on. It's dark. It's
Yeah.
and I'm aware of like where in time and space I am in the bigger picture of the earth rather than like I go into the building, I come out of the building, no idea what time it is, no idea what season it is. It's light when I go in, it's dark when I go out, or sometimes it's dark when you go in and dark when you go out, right?
Right.
It's like you're so
Yeah. Yeah.
disconnected and the fact of, when I think about veterinary work, it brings me back to the slow medicine that you referenced from the conference. So for folks who weren't at the conference, our most recent conference, one of our keynote lecture was a three-way discussion between myself, Dr. Mitch Lee, who's a human doctor, and Dr. Victoria Sweet, who wrote a book called Slow Medicine. What is it called? The Path. Oh, I have it right here. The Way to
The
Healing.
way to healing. I just bought it.
Slow medicine power. Woo, woo.
The
So,
way of healing.
yeah, the way to healing. And
Yeah. Can't
and when
wait
I
to read it.
yeah, it's you're gonna love it if you haven't already started it. But when I read that book, a few weeks prior to the conference, I was like, okay, this this is the person we have to speak to because what else is house call practice besides slow medicine? And it doesn't have to mean necessarily physically slow. Like you can be doing emergency house call medicine and it's still slow
Mhm.
medicine. It's a little bit more metaphor, like akin to the slow food, like you
Right.
said, like making your own food, having the time to tinker with your patients and to respond to them and not just 15 minutes, like, oh, what do they want now? That kind of
Right. Taking that
great
time.
taking the
Yeah.
time and that almost connectedness, not only to the patient and the client, but to the entire environment in which we live and using all of that to create a healing experience. So I
Yes.
find that your course is like, we should all be taking a cue from that and we should all be taking that course because I mean, I think part like, yes, excellent. I mean, I do that part of being a practitioner or, a healing practitioner or a veterinarian that heals others is making sure that you're giving from a place of health and well-being yourself. And we all miss that, or we're put into it not by fault of our own. The system puts us in a place where our hands are kind of tied unless we step right off the grid and then come back
Right.
on our own terms, just like you did, right?
Right. I had to totally step away because I think, had I had my children in the place where I was already working, I would have just gone back to work, which I did. I mean, I was right back the next week doing Saturday morning appointments and doing, just a little bit because they couldn't do without me, apparently.
Yeah.
So, wait a minute.
Mhm.
I don't have to do everything.
Right. And it is interesting also thinking about the fact that you homeschooled your kids. Like you've got an inherent desire to teach and educate from a place of reconnection to the world.
Mhm.
It's just
Yeah,
really,
it's
just really cool.
It's definitely about the connection, and it's the nature side of it is being that we can connect more with nature, with what's going on out there, and it helps us to connect with the people, once we learn how to work with the animals, how to notice them and listen to what they're telling us, it makes us more intuitive
Mhm.
when we're working with people and more intuitive just having relations with the people around us and, that desire to care for. And, this idea that just because we're taking care of, which I apparently am a caregiver, and
Barely.
but I find that the more, I guess, show empathy or, and caring for others, they care back.
Yeah.
And so sharing that's another part of house calls is being able to be my honest self
Yeah,
and
absolutely.
tell them I can't get up in the middle of the night and come see you because I have little kids or, because of my health or whatever reason. It doesn't have to have a reason.
Mm-hmm.
This is when I'm available. And the people that I keep as my core clients are the ones that respect that understand it, and I can make those choices as a house call vet.
Mm-hmm. And yeah, I mean, I love what you said, that as you give that empathy, you get it back and you get the understanding back and the ability to be your authentic self, and your clients can be their authentic self. And, it's a big kind of feedback loop. And sometimes,
Yeah.
it's just sort of this slow medicine, almost the idea of just being able to be present. It's not about the ego, like I know this and I can tell you what to do. And so much of veterinary medicine has gotten to be that way. And in many ways, we were forced into that too, just out of almost self defense because of the system, is kind of how I've experienced it. But when you can step outside of that and allow it to be like about the connection, then the medicine gets better, in my experience.
Yeah. Yes.
The
Yeah.
patients get better, more better.
Right. Yeah. Yeah. I see myself more as a facilitator,
Yeah.
as a veterinarian, and of course in hospice it's different, and they talk about that in some of the trainings, that there are times when you need the expert. There's time when you need that emergency vet to say, this is what we got to do, and we got to do it now. And then there are times when the decisions may be a little bit more fluid, and yes, we need to make sure the animal's not hurting. We need to make sure that we're taking care of, ticking off these signs of distress and problems. But when we get beyond that and just listen to, what does the client need? What's holding them back? Why are they unable to make this decision? Being able to have those longer conversations, then, we have that connection. But I feel more like a facilitator. And I think that's why I enjoy teaching, because I like to bring out the knowledge, and, I like to do it in an interactive way. I find I really dislike lecturing in big meetings. I've done that a few times and I get all stressed, and I don't like it, but I love small group conversational learning and teaching and facilitating.
Mhm.
So,
That's really interesting. I mean, as a teacher, a educator myself in a very different subject matter, but also there's a bit of
mhm.
self-care within the way I teach.
Oh, yeah.
It
There's a lot of self-care at the conference, and I loved that. And I think it's so important. Mm.
I'm so glad. And, I mean, I think you can't do the kind of intense work of creating your own business or sustaining your own business and your own practice if you don't also have a direction for self-care or an understanding that self-care is necessary, right? Like you can't separate them in my mind. And it's been changing for me, interestingly. Like I've started out with a little bit more of like, here's the information, you take, you build. And now I'm learning myself, like, what about uncovering the student's inherent knowledge? What about letting that shine instead of me telling you? How about me inviting you and facilitating for you to find the knowledge that you need? And like you said, there is a balance. Of course, there's factual things that have to be taught. there's
Right.
there's like danger zones that, I need people to like, don't step in that trap there, but that will trap you. Like there has to be some like straight knowledge,
Mhm.
but to some extent, I'm finding that a lot of the questions people ask are like, I know there's an answer in you. That's not coming from me. I can tell you my answer, but I can also
Mhm.
tell that there's an answer in you and you just need to we need to get it out of you. And, just by
Right.
facilitating. And so I think over time, over the
Mhm.
past couple of years, I've really, just like what you said, kind of the way you approach your patients and the way I approach my patients, I feel that has a role also in the teaching realm for me. And I'm learning that too.
Yeah. Yeah. That's
Yeah.
wonderful. Yeah.
So I wanted to kind of turn the spotlight back on a little bit of palliative care and just hear a little bit about what kinds of palliative care do you do? What does that look like to you? Like what is palliative care actually? Let me back up even further. Let's hear what that means to you.
Well, the simple thing that I think of, especially that I talk to clients about, is that palliative care is comfort care. It's what is going to take the pain away or take the symptoms of vomiting, diarrhea. It's all those things that cause distress or discomfort. And we use palliative care all the time. We use palliative care in our post-surgical pain medications. They don't have to be dying to get palliative care.
Right.
But in end of life care, we're focusing in on that palliative because we've basically recognized that curative is no longer an option, that we're not going to be able to fix this. And that's a brain change,
Yeah.
that we're not going to fix this. We're not going to avoid dying. Dying is going to happen. And to be able to have that conversation, however bluntly it comes out, depending on the client, whatever they're prepared for, usually it's not that blunt unless I've worked with them so many
Right.
times that they,
Right.
but it's, we're not gonna be able to stop this. We're not gonna be
Mhm.
able to change things, turn back time. But if we can make them more comfortable. What does that mean? What does that look like? And what is your animal's priority? What makes them the most comfortable? What makes them happy? What do they love doing? Do they want to lay out in the sun? Do they want to be able to sniff around the yard? What brings them joy? And how can we keep them doing that for as long as possible? And, changing expectations. We do the quality of life scale, and they talk about mobilities and what they love to do and what they don't. But you've got to put it in context, because my dog, who loved to run around at 2 years old, he's not running around like he did when he was two. Now he's slowing down. And yes, I know he's getting his pain meds and he's getting herbal treatments and other things because I'm integrative, but I do use pain meds. I use everything that we have. And that's what integrative medicine is, the ability to use whatever we have, this multimodal management of things.
Hmm. I love kind of how you explain that there's some degree of working with the concept of acceptance that
Mhm.
inherently has got to be a part of palliative care, that we know death is going to happen. And even if it's not imminent, which it may be, there's still, in order to move forward with the palliative paradigm, you are accepting that we're not going to stop death. And I think in so many other styles of medicine, especially a lot of specialty medicine, there's almost some degree of denial, I feel, that's like, we're gonna do all this stuff in hopes that they won't die. And it's like, but you're gonna die. I mean, it's
But they
terrible.
will.
It's a matter of time. It's
Right.
of course.
Yeah.
Um,
Yeah.
but getting a little bit closer and holding a little bit nearer and dearer the idea that, we're not gonna live forever, and to prioritize a little bit more of the time we have. How do we make that good? And sometimes it's not by trying to have a cure at all, right?
Right.
Mhm.
How does your animal want to live their last days? And, in my early days as a vet working in an emergency clinic, so many animals died in cages because we were trying to save them. And we didn't, especially back then, have these conversations. And sometimes we would. And I think even then I recognize we need to be talking to people a little bit more about this. We need to be bringing this up earlier so that they're prepared for it. And it's hard. It's not an easy conversation to have. So that's why, it's not an official specialty, but it's a niche of
Yeah.
practice to
Mhm.
do hospice and palliative, and to have these longer conversations with people that maybe are hard to do in the clinic and hard to do, when the schedule is busy or when you don't have that slow time.
Yeah, yeah. I mean, it is really interesting, and I think what you said about having it be brought up earlier, I think you don't
Yeah.
have to be a quote unquote palliative vet or have any sort
Right.
of specialization in it. I think, the nature of the work we do as veterinarians is there's palliative care involved all the time. And our patients are all going to die on our watch, and human medicine, human doctors have their patients their entire life. Like, they grow old with their patients. For us, we're going to
Right.
lose every patient we've ever had. There's no
Hmm.
way around that, and we don't talk about that in terms of our own experience as providers, how painful that is. But also,
Right.
every client that we have, if we are caring for them at some point in their life, they could die at any point during our care of them, whether we're a specialist, a palliative care provider, an IHE provider, or general practice, giving them vaccines.
Mhm.
Um,
Right.
and every moment of the care of an animal has embedded within it that they're going to die within our lifetime. Like, it's going to happen. It's very depressing, but at the same time, it's life. It's part of the wholeness of life. And
Right.
right.
Mhm. Right, it's that cycle that is there, and so I feel like even my self-care course, we're not like toxic positivity, we're going through the whole season, we're going through, the whole death and remembrance and rebirth, or birth, coming back around, bringing new life,
Hmm.
and to be able to face that, I think, every generation before, 100 years ago, people saw their elders and they saw them deteriorate and die, and now we put them in these facilities and don't see that process. And maybe that's kind of why I am who I am, because my mom was the one taking care of all, the grandparents, and I watched her do
Mm.
all that caregiving. And so that I saw aging people and how to care for them and all that. So I was kind of raised with that. And
Yeah.
but
It's very
not everybody sees
important to
that.
say. Yeah, you're absolutely right. I mean, a lot of this sort of gets sanitized, right? Like,
Mhm.
oh, someone else is gonna take care of that, or some of the hard realities of that cycle of life are just not in our view anymore. Um, that yeah, it's very, very powerful stuff, and I do wanna corroborate that there's no semblance of toxic positivity. I think that that's such a problem in the wellness industries, and
Mhm.
there's just so much what's straight denial. Um, but I believe, and I think based on your teaching and our conversations, that, part of healing is acceptance as well, even
Mhm.
things that aren't, always quote unquote positive. Uh, that's okay.
Finding gratitude in what's there and what we have,
Hmm.
but not denying the fact that we're sad or, that we have emotions, that we're human.
Right, right. Anger is a normal human emotion.
Mhm.
Sadness is a normal human emotion. Jealousy even is a
Mhm.
normal human
Yeah.
emotion, right?
Right.
There's a time and a place for all of that.
Mhm. Feel them and move through them,
That's
and it's
right. That's right.
healthier.
Yeah. So kind of on a more clinical side of things, do you have any sort of like favorite palliative therapies or case successes with cases that you might be interested in sharing with people? I hate using the word tips these days. I've been using the word tips. Like, come on, it's so much more than a tip.
Right, right. Yeah.
Like any sort of
I
success with, any particular modality or anything like that.
Yeah, well, I've enjoyed working with the herbs, obviously, and it's they're not cure-alls, they're not gonna save every animal, but there are a lot of herbs that have qualities that support liver and kidney organ function. They're antioxidant, anti-inflammatory, and so even if we don't necessarily know what's going on, if we can get some supportive herbs into them, they just seem to feel better. I feel like it smooths the process, if anything else. It just kind of, if we get the right combination, and I talk about herbs for pain, but if you need the meds, do the meds, but they're complementary. They work together, and acupuncture, other modalities can work together, but I really enjoy the herbs, and, it's a super simple thing that I learned when my kids were in preschool was to make the calendula salve that, make an ointment that you put on scraped knees and things, and I started using it on animals and on, pressure sores and things like that, and there's a beeswax base to it, so it gives a barrier, a waterproof barrier, so you can keep them clean, and there's an antiseptic quality to it as well, and wound healing. Used it on rats with, the mammary tumors that outgrow their skin. Using this calendula salve, it just helps the skin to kinda keep up with the tumor. It's not gonna get rid of the tumor, but keeps that scabbing down, and it's edible. If they eat it, calendula flowers are edible.
Mhm. That's
So,
incredible. That's incredible.
yeah.
I'm totally drawing a blank right now on that herb. It's a Western herb that staunches bleeding.
Yarrow.
Yarrow, yes. I was like, "You're
Yeah.
gonna know what it is."
Yep.
I'm seeing the
Uh-huh.
plant in my head, but I'm like, "What's the name of it?" Because I always get it confused with
Mhm.
yarrow root, and I'm like, "It's not the root." So yarrow, I foraged some yarrow a few years prior, and I was just, like, hoarding it in my kitchen. Like, I know I'm gonna use
Mhm.
it someday, and I had a dog who had perianal fistula that started bleeding like crazy, and they went to the ER in the middle of the night, and they came back, and they had all the Western meds and everything, but there were these still kind of breakthrough bleeding episodes, and we did the Yunnan Biao, but I was like, "You know what? I have some dried yarrow that I've kind of processed into powder. Can we try and use that topically?" And lo and behold, that's what did it. That's what kind of kept that bleeding in check and, like, kept the clients from freaking out because they were freaking out. That's what was, like, this little bit of bleeding isn't the end of the world, but it was a freak out. The yarrow.
The perception, yeah, 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 and I've used it orally on dogs with nasal tumors and had just amazing results. Dogs that they're just starting to drip and, think, "Oh, man, that thing's gonna blow, and it's gonna be a traumatic experience."
Mhm.
But once I started adding in yarrow, then they just don't seem to have that problem anymore, and
Mhm.
it
Yeah.
still grows, and it becomes uncomfortable, and they end up being euthanized at some point, but they don't bleed all over the place and
Mhm.
have the other problems. In my experience, I'm sure it can happen. But
Course, of course. And then would you mind sharing maybe one of your favorite, top few herbs for pain and maybe a couple for kidney? I mean, it always depends on the pattern, right?
it
But
really does. Yeah, yeah, it depends on, there are a lot of things we think about. We think in just like in Chinese medicine and other herbal modalities, there are herbs that are drying, that can dry things out, and there are herbs that are moisturizing, herbs that are really hot, like ginger,
Mhm.
or herbs that are cooling, like marshmallow or cucumber. You think of, like plants that really cool you down and that warm you up. So ginger and turmeric and boswellia are really great for pain, but you don't wanna get it too hot 'cause, I get these Alaskan breed dogs that are so hot already, and I don't understand it, I can't even relate to it, but when winter comes, they feel so much better, and they're running around the yard. They're the ones you don't wanna over ginger, you know? You don't wanna too much, or they're just miserable.
Mhm, mhm,
So it's very much about the individual, but those are some. Corey Dallas, I use Chinese and Ayurvedic
mhm,
herbs
mhm.
as singles. The thing I love about Western medicine was being able to get to know them as individuals,
Yeah.
and then I combine them into formulas based on the individual patient.
Mhm. Fantastic. I love that. Those are some of my favorites too. Boswellia is I have a special place in my heart for that one.
Mhm. Yeah, yeah.
And can I ask you on the kind of Western side of things, do you ever do like crisis kits or anything like that? That's a big part of the conversation with palliative medicine. And a lot of people
Right, comfort
here
kit.
here with sort of like the DEA regulations, what are you allowed to leave at home and what
Mhm.
how do you handle that, if you wouldn't mind
I
sharing?
handle it very individually. So I don't have like one thing that I give to everybody. And I'm having conversations with clients pretty regularly.
Mhm.
And so I don't always give them the pain meds. The main thing is to have an emergency plan, and their emergency plan, most people that I'm working with are, if they need euthanasia in the middle of the night, they're gonna go to the ER, and that's their plan, and they're okay with that. But that is something that you can do. You can have them have medications that will tranquilize them or calm them so that they know that they can call you and you can get there in a time. I worry that they're gonna come out of that, and so there are concerns that way. I have an epileptic patient right now that he's got midazolam on hand for intranasal use if needed, and so he's just got his little secret box stash up on the high shelf that's got the midazolam in it, and so we do that. We give Valium pills, we give all kinds of medications. They've got phenobarb, they've got all these other medications. So it's scary when it's on a syringe with a needle,
Yeah, yeah, yeah,
maybe, but
yeah.
but it's the same thing. DEA, we prescribe it, they've got it, and if they don't use it, they need to know how to handle that and how to dispose of it properly.
Mhm.
And the clients that I work with, I know pretty well, and I know how often they're getting their meds, and I know that they're not going somewhere else and getting too much, getting
Right, right.
more.
Right, right. Yeah, that is the thing when you're a house call vet, you have a little bit more intimate knowledge of the person with whom you're
Mhm.
working, right? It's not some
You
random
hope.
that's out there, drug seeking from you.
Mhm. Yeah, I've seen those clients in practice and know what they look like, and,
Mhm.
that the one that's knows the drug they're looking for before they even get the diagnosis.
Right, right. Only hydro works for me, only Dilaudid. There's no other medication that could
Right.
possibly work. I don't want an NSAID, I
Right.
want Dilaudid. Fun times.
Yeah, it's just scary. I'm glad I don't have to deal with that.
Yeah, yeah. So, is there anything else that you'd like people to know about you or your offerings before we close up here for the day?
I think the big thing is that, my self-care course, I would love to have anyone who wants to be in my self-care class join me next time. It's going to start in September, but I need to know by August if people are going to sign up because I have to put all the care packages. So you get a care package, as Eve said, that you get to open one each month. And,
Mhm.
it's got a little tea in it and a little something special each month, sometimes it's something to do, sometimes it's something to look at or smell or
Mhm.
So I'm probably going to start advertising, but taking payment for it and having people sign up in June. And so there will be a discount for people that sign up before July 1st. And there'll be a discount for return people because there's always people that want to do it again. And there's a Zoom component, a group Zoom every month. And so that's always different. And I am always adding something every year. So there's discounts for return people and discount to get it. Let me know by July the 1st or
Okay.
maybe July 15th. We'll find out.
How
But,
do
and
people
so, yeah, my
find you or
my
find
website. Yeah, my website is krisaugust.com. So KRIS, August, like the month,
Mhm.
.com. And so go there and please sign up for my email list, and then you will get notified when the course is available again. And I
Okay.
send occasional blog emails and things, but not very often. So
Okay. Awesome. Thank you so much for sharing about that. And in closing, I want to ask the question that I ask at the end of every episode. What is your favorite beverage? Whether that's tea or coffee or
take a guess. It's
cocktail.
tea.
Okay.
Mhm. Yeah.
Very
Yeah,
nice.
I drink lots of different teas, but I like green tea, but I also have blends depending on what I need for my health at that particular moment. So
Beautiful
drink
thing about
lots of tea.
tea. There's so many types
Right.
of tea, and they can all be therapeutic depending on how you use them.
Mhm. Right. Yeah.
Love it. All right, my dear. Thank you so much for our chat today. And I will put in our show notes how people can access your course and get in touch with you. And I look forward to our next chat.
All right. Thank you so much, Eve. It was great fun.
Same to you.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for House Call Vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.
If you're looking for help with ultrasound scanning, check out First Opinion Veterinary Ultrasound for independent machine reviews and online and in-person teaching options. FOVU, simplifying ultrasound.